Hey guys, it's the Psych NP, and today I have something to share with you guys. I am going back to school for my DNP. This is something I've been on the fence about for some time, but I finally took the plunge. I started in October, and I also have a student with me today. Her name is Grace, and she'll be doing some questions. All right, guys, let's get to it. Guys, so why am I going back to school for my DNP? And I've thought about this for a while. I've always been on the fence, and I always hear people saying, Fabius, there's no point in getting it. It's just fluff. You just do papers and research and you're not going to build on anything clinically. But the one thing, guys, is, over time, a lot of these other professions look down at our profession. They think, the MSN is not good enough. The DNP is not good enough. We're not getting enough clinical hours. And it could be the case, compared to the PA and the MD and DO roles, maybe we don't get enough hours. I know our argument is, oh, as an RN, we work this many hours, but it is different being a provider. The level of knowledge is much more significant, and you really have to study a lot harder. I mean, it's different. But for me, it's our terminal degree. You can build us a little more respect with our profession. And again, with the DNP, the goal is to kind of understand the whole healthcare system, the whole spectrum of everything. For us, we're right now as an MSN, I'm focused on my patients. I have my own private practice, but this is trying to implement change, trying to change policies, those things, and having the best data, the best evidence-based practice. When I was working in inpatient psych as an RN, there were things that I wish I could change, but obviously it's different when it's a whole healthcare systems policy. I mean, you can't just, even with a DNP, but if you give them, if let's say you become a CEO or a director of nursing or of a hospital with a DNP, you can do these things. You can really try to implement change, and that's one of the biggest things. I know a lot of people talk about the DNP, is useless and there's no point. But the one thing, guys, is a lot of people say that the associate's degree of nursing is going to go away, and you're gonna you need to get the BSN if you want to work as a nurse. And people are saying if you have an MSN and you want to practice, you're going to need a DNP to practice as a nurse practitioner. And I still don't think that's going to be anytime soon, because still there are still associate's degree nurses that are working. But I think in a way it's something that at least it's your terminal degree. You don't have to worry about that at all in the future, and then that's pretty important. So what will change if I get my DNP? I'm still going to be working this private practice. I'm not going to leave. I'm not going anywhere. Hopefully, if I get this DNP, I can implement some of the things I learned in this program and try to improve my practice. And I can do that because this is my practice. I can implement anything that I learned from there. And hopefully I can really help, maybe change some of these things on the outpatient side. I probably will steer clear from the inpatient psych. That's where I used to work as an RN, and not to say that right now I just don't know enough, but in the DNP program, if I have a rotation in an inpatient psych unit, I can maybe look at things in a different way and learn new things. Where am I going to be going? Again, like I said, I'm not going anywhere. I'm still staying in the same place, but you never know. Maybe I could teach as a professor at another university. If you guys know a little bit about me, I've taught at Johns Hopkins Masters of Nursing program in mental health. I had 8 to 10 students, and they were doing their clinicals. I also did simulation labs. And then also for Drexel's Psych NP program, I have some clinical students there as well. So I've done a couple stints at teaching, but with a DNP, you can actually become the professor, and you can really teach the whole course. With the MSN, I could do a lot of the clinical instructors and those parts, which I liked, but maybe it's a different, fresh experience for me. Can I work in a different setting as a DNP? The one thing that you can do with a DNP is, again, more flexibility, more career options. If I want to teach again as a professor, if I want to become a CEO or of a hospital, or if I want to do director of nursing, or those higher level management leadership positions, you can do that. Those are things that or a medical director of another practice. I think you can still do it as an MSN, but I would say that maybe you have a little more bearing as a DNP, because again, it's levels. You're looking at the whole level of the healthcare system. You're looking at the whole big picture and trying to understand how all these systems flow together. And it can get really complicated when you're an RN. You just look at you see your patients and those things, but then you come an NP. You have your patients you take care of, but then there's a whole nother level of looking at the whole, whether it's a business side or the overall quality of patient care for everyone. And there's so many things, or whether it's staffing. I mean, there's so many different things you have to look at. Pros and cons of the DNP. So pros wise, I would say that it's a terminal degree. You can't really go up from here. And again, you really learn a different kind of thinking, a lot of evidence-based practice, a lot more data, a lot of things that you can implement change. And a lot of us came into this profession, whether it's to help people, but again, if the bottom line is to help people and try to and change things, a DNP will help you with a better and bigger platform. And for the school that I chose, I'm going to Frontier University. It's a good university, and I'm excited because I started there in October. But that's a big thing. One of the essays they asked me was, why do you want to get a DNP? What's so important to you about it? And for me, using my YouTube and TikTok and social media platform, having a DNP I think will help me a little bit. I still think I'd be okay with just my MSN, but I'm still young, I'm still hungry, and I think for me, getting this DNP would really help me out, and also just help you guys understand things a little bit better in terms of those systems, and maybe there's some policies that really need to be changed. The cons are that there's a financial burden of the DNP. There's not so much clinical based. It's a little bit clinical based, but it's not. Your nurse practitioner program for your master's, and you're really doing a lot of clinicals. This is a lot of research, and those things and papers. So there's again that the burden of the finances. My program costs $19,000, and luckily I'm in a position now where I can pay that just out of pocket. But before I would need student loans, and that's again, no one wants more student loans. Student loans are not fun, and I get that. Okay, but there's drawbacks, as in you're not going to learn anything clinically. You're just going to do again fluff. That's what people think. And so there's negatives. Will I become a better clinician? I might be. I don't know yet. But once I go through this DNP program, I'll have a better idea. But for me, there's some positives. I have time right now. I'm only working Monday, Tuesday, Thursday, so I have time to do this DNP program. And if I need to cut back, I can work 1 or 2 days a week instead if I need to. So there are things I'm trying to do, guys, but I'm excited to start this DNP program. I'll let you guys know how it goes over time. All right, guys, take care. What's going on, guys? So this is Grace, my Psych NP student that is mentoring under me. This is actually her 4th or 5th week, and she's growing leaps and bounds. She's getting better and better. And I'll be honest, guys, she's probably she might be my top student that I've had, and all my students have been really good. But Grace has been on the ball. She's been studying. Again, this is her first rotation, and I think she's ready to see patients. But this is Grace, and I'll leave it off to her.
Hey, I'm Grace. Just wanted to let you know I've been registered nurse for 20 years. I work at the Baltimore hospital, 13 years for med-surg rehab, and then another 7 years in the surgical floor. I'm married. I have 2 kids, teenagers now, so I can leave them at home. Another thing is, it took me a good 2 years to finish the prerequisite. Why? Because I am full-time mom, I am a full-time student, and I'm a full-time working. So, I work at the federal government right now. I can tell you where, but I like it. At the same time, it will come in the nursing, it will come on your time. You want some change, and I guess that's what happened. That's why I went back to school. I want some change. At the same time, I want to be a little bit off bedside, and I want to be more centered on what I want to help the patient. That's when I realized I want mental health, psychiatry, nurse practitioner, and I want outpatient if possible. I've learned that if I can follow up on the patient outpatient wise, they can go home and then they can live their normal life. So that's when I learned I want this, and that's when I started the program.
Okay.
The biggest challenge for me, and I will tell you, as a full-time mom and a full-time student, and I'm doing practicum, the biggest challenge is time. How do I do this? I make my kids do most of their work. I give them work, but at the same time, so that I can have enough time to study. I cannot come here without studying, believe me. Fabius will ask me questions. I know my neurotransmitter when I come here. I learned some of the medication. You know why? Because I want to be prepared. So I hope to see you guys, and I hope to learn more from my preceptor.
All right, guys. So this is Grace. We're excited again. It's our first rotation. She's going to be with me for the second rotation, and we're excited. All right. Bye, guys. Take care.
See ya.